So, what are the core principles of minimal access surgery which every OT staff, especially the surgeons, should be aware of and should be practicing and following? So, these are the various core principles of minimal access surgery, and I'm going to start by talking a little bit about the ergonomics of this kind of surgery. So, the first principle is we must follow ergonomic efficiency. Now, what I mean by this is ergonomics is the science of designing and arranging the equipments or machines in such a way that the people and the machine they interact in a more efficient and a safe manner. So it is basically about understanding the man and the machine interface. And if you look at laparoscopic surgery, it is entirely dependent on machines and equipments. Your laparoscopy system includes a complete endovision system. You include an energy source device there, you have a suction machine there, you have a light source there, and you have an insufflator there. And then you are going to operate using different hand and operating instruments. So, laparoscopic surgery is entirely equipment dependent. And that is why ergonomics is one of the first important core concepts which any laparoscopic surgeon should understand. Unfortunately, there is a big lack in this awareness. And this lack of knowledge of ergonomics leads to a lot of struggle during the surgery. It can prolong the operating time of the surgeon. It can cause more fatigue, more physical wear and tear to the surgeon. It ultimately affects the efficiency of the surgeon, and this indirectly may increase the risk of complications happening during the procedures. So, in a large survey of more than 5,000 surgeons, it was found that 70% of the surgeons reported some sort of pain or muscle strain because of the surgeries. Now, this could be involving your back, your neck, your upper body, your arms, your shoulder. And surprisingly, only 29 to 30% of this took it seriously and saw what was wrong and how to improve this. That means majority of the surgeons are still lacking that awareness of the ergonomic concepts of minimal access surgery. So I'm going to quickly mention a few of the very important ergonomic principles. The moment you start talking about laparoscopic surgery and you enter into the OT, you must make sure that you are following these principles. The first principle is that of coaxial alignment. And what I mean by that is when the surgeon is standing and operating upon a patient, then the eye of the surgeon, the target area where the surgeon is going to operate, and the monitor on which the surgeon is going to see while operating, all the three must be in the same axis, in the same straight line. You know, this is known as the principle of coaxial alignment, and we follow it in real life. If you're driving a car, where do you sit in that car while you're driving it? You are sitting right behind the steering wheel, isn't it? And you're looking directly at the road. When you're watching a TV, where are you sitting? You are sitting right in front of the TV screen. We follow these coaxial alignments. It comes naturally to us, and we must remember to use these principles when we are operating also. So, whether you are doing a lap chole, lap appendix, hernia, a TLH, any laparoscopic surgery, always follow this coaxial alignment. So, in some surgeries, like some pelvic gynecological procedures, we can have a little bit of liberty, and the monitor, if it is not right in front of the surgeon, could be placed at least or maximum of 10 to 15 degrees either to the left or the right. It is okay, and we can still manage to do the surgery ergonomically, because here I'm talking about pelvic procedures, and the organs like the uterus, the tubes, the ovaries can be manipulated, and hence it doesn't affect much if you're not following the coaxial alignment to the T. The next important principle is make sure that you are placing this monitor on which you're going to see at the ideal distance. So, what is the ideal distance to place the monitor? How far that monitor should be away from the surgeon? Well, there is a very simple formula for that. Find out the size of the monitor. Now, supposing you have a 12-inch monitor, simply multiply that 12 inches by 5. So the distance between the monitor and the surgeon should be 5 times the size of the monitor. This is very important because at this distance, you will get the maximum resolution of the eye over the macula in the retina of your eye. So you will see the sharpest image on the screen if you, as a surgeon, are going to stand at a distance which is equal to 5 times the size of the monitor which you are going to operate upon. Something very simple but very important is the correct height of the OT table. So the height of the OT table should be such that when you're operating as a surgeon, your hands should be at your elbow level and your arms should be by your side. The arms should be adducted. Any other position except this is going to increase your strain. It is going to cause more wear and tear on your body. So how do you find the ideal height of the OT table? Roughly, it is about half the height of the surgeon. So if you are 5 feet tall, the OT table should be 2.5 feet tall. This is a basic thumb rule, very simple. And if it is higher than that, what will happen? You can see in this image here, the moment the height of the table goes above your waist level, you will have to lift your hands above the elbow level. So you are going to operate in a very awkward position and your arms will also be abducted. This brings down the efficiency of the surgeon. Any abduction of the arms of the surgeon beyond 15 degrees will cause more and more fatigue, decrease the efficiency of your surgeon, and also increase the chances of complications. So, simple principles which are easy to implement, but we need to remember and start practicing them.